Hello, my name's Andy Knox. I am a GP working here in Morecambe Bay. And over the last 3.5 years, we've been trying to build together a new way of working within healthcare, which we call Better Care Together. It came out of huge financial pressures, which our hospital trust was under in the Bay. And we realised that in order to have a sustainable NHS that is affordable and accessible and safe for the future, we needed to reorganise ourselves and work together in a more efficient and effective way to try and really care for the needs of the population that we look to serve in the most compassionate way. So we've been on this journey together of trying to break down barriers between organisations and find new ways of partnering together more effectively, so that instead of working in individual silos which are in competition to each other, we actually learn to let go of some of our age-old ways of working and find new partnerships and new relationships as we let go of some of our own individual control mechanisms and learn to trust each other and find better ways for the future. This next month we're going to be seeing what we call an accountable care system around Morecambe Bay, where organisations such as the Hospital Trust and community services, general practices, all kinds of different organisations, the Mental Health Trust, we're going to be trying to let down some of our barriers and learn to pool our budgets and share our resources more effectively together. We need a different kind of conversation here in Morecambe Bay about what it means to be healthy and well. There are huge questions for us, and we don't have very many easy answers. We also know that 1 in every £5 spent on healthcare around this bay is spent as a direct result of lifestyle choices that we make. That doesn't make healthcare affordable into the future. And the answers are not easy. We're in huge debt as a health economy. Most of that is not our fault. It is the reality of the situation that we live in. But it means that if we're going to have healthcare that is safe and sustainable for everybody in this bay, we've got to change our conversation and we've got to work out what it means for us to be healthy and well. You know, there's a famous saying that says, in a time of turbulent waters, your enemy is not the turbulent waters, it's trying to tackle them with yesterday's thinking. The problem is, for those of us who work within systems, is that often we're so conditioned to thinking in certain ways that it's hard for us to think outside the box. That's why we need far more wide-reaching conversations that involve as many people as possible around this bay, because there are two really key things for us to tackle and face together. One of them is about how we're actually going to live differently. It's not okay that in Morecambe Bay we have some of the worst health stats in the whole country. It's not okay that in parts of this bay that some people's life expectancy is only 58, whereas other people have a life expectancy of 85. That's not okay. It's not okay that we have some of the worst early death rates in the country. It's not okay that we have some of the worst poverty statistics in the country. It's not okay that we have some of the worst diabetes rates, some of the worst obesity rates, some of the worst heart disease rates, some of the worst cancer rates. We have to do something about that, and we have to have a conversation about what it means for us to be healthy and well. It not just being physical health, but really understanding how we can be well mentally, how we can be well socially, what our relationships are like together as communities, how we care for each other, and what it means to be systemically well. What does it mean for us to be able to have flourishing lives in the context of austerity, in the context of advertising giants making cheap food unhealthy and healthy food to be so expensive? What do we do in the face of some of the economic choices that are in front of us? The answers aren't going to be easy, and that's why we need the wisdom of everybody. It's why we need everybody involved in the conversation. And the second part of the conversation for us is not just how do we live better and more well and what do we want, but what do we want from our healthcare system? It's not just that we can have what we want anymore. We need to look at what we need together and build services, perhaps to be completely different to how they've looked before, and face up to the fact that the NHS as we've known it is no longer sustainable. But we do still want free and brilliant healthcare for everybody. And so we're going to need to make some choices, and those must involve communities. They can't just be made by people of power in offices, because we don't have the answers. We need communities to come together in conversations and work through some of these issues about how budgets are spent and why they're spent and what we're going to do with them, because there are some tough choices in front of us. So you're going to see that conversations are emerging and accessible around this bay. We've already chatted to over 1,000 people in Carnforth, and those conversations are continuing. But we want to see those in Garstang, in Morecambe. We want to see them in Lancaster. We want to see them in Kendal and Ulverston and Barrow and Dalton and Millham and all the parts that make up this bay. So when you see that conversations are coming around Morecambe Bay about what it means for us to be healthy and what kind of healthcare system we want in the future, come and be part of those conversations. Come and let your voice be heard, because no decision can be made about you without you unless you let that happen. It is vital that we learn to have a different kind of conversation here in Morecambe Bay. You know, one of the great things that happened in the last century was the civil rights movement, where the momentum picked up to the extent where you end up with brilliant Barack Obama as the President of the United States. But you know, the fault of that whole movement was that it believed that what brings about change is getting the right people into the positions of power. Actually, what we need around Morecambe Bay is a people movement that begins to gather momentum and calls for a different kind of future, that actually makes those of us in positions of power shift our ground and find a new way of relating, a new way of being with the whole of society together. We can have the kind of healthcare and the kind of health and well-being that we want together here in Morecambe Bay, but not without getting together, not without some conversations to bring about those kind of changes, not without taking responsibility for our health and our well-being more together. So there are some tough things for us to talk about, and we are in uncharted waters. We don't know what to do. Our boat is falling apart, and we are forming rafts to kind of find the future together. So come and be part of those discussions as they emerge around Morecambe Bay. Come and be part of this people movement that is gathering momentum, so that we can have the kind of health, social care, and the kind of society that we want together around this bay. It is time for a people movement. It is time for fresh conversations. Please come and be part of it.